Good evening, everybody. So as Emily has introduced, I am Sherry. I'm a principal physiotherapist and I specialize in the field of musculoskeletal physiotherapy. So I work at this clinic called MLab, okay, and it is my joy and privilege to be here this evening to share with you more about telehealth for physiotherapy. Okay, what is it? When should we do it? And why should we even embark on telehealth for physiotherapy? Okay, so we would like to give a, a big thank you. Okay, say a big thank you once again to Smart Nation for allowing us to share this knowledge with all of you here today. Okay, and feel free to ask any questions along the way pertaining to today's topic, and I'll try my very best to answer each and every one of them. So just a little more about myself, as I had shared previously, I specialize in musculoskeletal conditions. So as the name says it's combination of muscles and your skeletons, aka also known as your bones, right? And this is really from top to toe, where there are conditions that can really occur anywhere in our body. I have been practicing as a physiotherapist for more than 10 years now. My specialties include sports injuries. My very favorites are actually treating conditions of the spine and even the TMJ, or what is also known as the temporomandibular joint. Okay, so in a more layman terms, it's also known as your jaw. So things like your clenching, your grinding your teeth at night, okay, clicking, dislocations. Okay, all these can actually be treated through physiotherapy. And I think this is something that not many people know of. Okay, so moving on. Also, I specialize in doing a lot of post-surgery conditions. So after you have your surgery done, the success of a surgery is also determined on what you do after your surgery, the rehab that takes place after your surgery. Okay, and also we do quite a bit of, I specialize quite a lot in desk-bound conditions and also ergonomics for the office worker. So today's topic is what really is telehealth and when you should do it and why we should do it, right? So telehealth is also known as telemedicine in other countries, or even in Singapore, there is sometimes this term is used interchangeably, okay? But it's all the same. It actually is the use of communications technologies, right, to provide healthcare from a distance. So the origin of telehealth is actually where we are trying to deliver healthcare to someone who is living very far away, or maybe not really have easy access to healthcare, right? Okay, but in this day and age, we see getting more and more common. Okay, so maybe I'll just pose a question to the audience today. How many of you have actually already seen a doctor, like a GP, okay, using a telehealth platform? Okay, that means you actually see your GP maybe on the laptop, okay, via a video call, or even on your phone on the go, right? Maybe you're leaving work, you're on your way home, okay, and you have done this consultation through technology such as this. Okay, so during telehealth, so some of you have already embarked on it, right? And I think maybe what would the feedback be? It's quite convenient. It's very quick and easy. So I myself, I've done it before, and I was actually very surprised, very pleasantly surprised by how smooth it went. Just I called the clinic, I arranged for a session with the doctor, and I asked actually, do I have to go down, do I have to take a queue number, do I have to register? And they said, no, it's okay. We understand that you're currently at work and you can't really leave and start to join the queue, right? So let's offer you telehealth. Okay, you're already in the queue system. When the doctor's ready, they gave an estimate time. right? When you can see the doctor, you just need to prepare yourself and the doctor will call you. Okay, and then that's where the video call takes place. And I personally love it. It was very convenient, very quick, so much time saved. Okay, I could still continue finishing up my work in the meantime. Okay, so for those who embark on telehealth, right, you can still do a lot of things through telehealth. Okay, you can monitor your parameters like your blood pressure, your heart rate, even your SpO2. Many of us nowadays would have such measuring equipment at home. Okay, especially the SpO2, right? So because of this recent COVID pandemic, the government has supplied every household with an SpO2 monitor. How many of you went to collect it? Right, and it's actually very useful, especially if those of you who actually really tried it yourselves. Okay, it's you'll find that you'll be quite pleasantly surprised that the SpO2 also measures your heart rate, not just the oxygen concentration, right? Okay. So SpO2, some of you may be wondering, is actually monitoring your oxygen concentration. Okay, so it's how saturated your blood is with oxygen. And anything that is above 95 and above, right, that is healthy. So why the reason did the government issue this to every household? Because COVID affects the respiratory system. And if you still remember the early days of COVID, where it was a lot more severe, there was no vaccine, people were struggling to breathe. A lot of them had to be put on supplementary oxygen, okay, either through a nasal tube or a facial mask. Okay, and it's this additional oxygen that then helped to bring up the saturation of their oxygen level in the blood again. So the purpose of measuring your SpO2, many times it's to see whether has it fallen below the healthy range of 95%. Okay, and also of course it's usually always accompanied with other symptoms such as breathlessness, okay, or sometimes you will feel very faint, okay, because there's not enough oxygen circulating in your blood, okay, and then that means the brain is also deprived of oxygen. Okay, so good question. So I think some of us may be wondering like how accurate is the SpO2, right? Yes, of course, it may not be medical grade, okay, but it will serve some sort of a reading at general reading. Okay, anything that once you start to see it declines, right? You have to get medical attention immediately. But as mentioned, there will always be symptoms that accompany. So it's not like you're feeling well and then you look at your SpO2 and suddenly it starts to decline. So it doesn't work that way. Usually when the SpO2 starts to decline, the person suffering would start to experience a lot of other symptoms. Okay, so some of us may be wondering how accurate is the SpO2? Like once I say it's not medical grade like what you get at a hospital, but it is good enough to give some sort of a feedback. Okay, maybe you're on your way, you're already having symptoms, you're on your way to get help. Why not just put it on for further monitoring? Okay, then you can observe its fluctuations. So not aside from actually now accumulating all these measurements, okay, your parameters, right, like your BP, your blood pressure, your heart rate, your SpO2, etc., and sometimes even the glucose. Okay, so for some of you in the audience who may do some blood sugar testing, okay, sometimes when you can upload it onto like a device. It depends on how linked all your devices are, or maybe you have to key onto manually onto an online platform, and then the doctor will have access to it. Okay, or it can be just during the session. As you take it, the doctor will ask you, okay, what is your current reading? And you give the reading to your doctor so that your doctor can also include it in their notes, right? And one thing good about all these smartphones that now you have, and even additional smart personal devices, is that it's not just collecting. So whatever the doctor has collected from you, okay, it can also then be reverse. So it can also be disseminated back to you, right? Depending on what is, so for example, maybe you take a blood test maybe several weeks ago, okay, and then now you're having that telehealth consultation with the doctor, right? The doctor is trying to explain to you what are your results. So in this manner also, the information from your blood test, okay, or whatever testing you may have done, okay, at a medical clinic beforehand, can then be disseminated back to the user or the consumer, okay, and it will give a very, from there, it's a bit more of a live update, okay, or a very quick analysis of what's your current health status like, okay, and then from there you can start to maybe plan your other consultations with maybe a specialist, etc. Okay, rather than sometimes, you know, you have to wait another 2 weeks just to see the doctor again because of the long queue. Okay, telehealth does help to shorten that waiting time. So I'm going to try and read out some, I'm going to try and answer some of the Q&As that I'm getting. Okay, so I think some of you are asking like how accurate is it, right? Via online. Actually, really, it's depending on also what is the machine that you have at home, right? So for example, if it's a blood pressure machine or your heart rate machine, I would say, or a heart rate, I think nowadays a lot of our smartwatches, those of you who wear like, you know, Garmin or Apple Watch, etc., and then there's that little function to measure your heart rate. I would say actually it's pretty accurate these days, you know, because elite athletes use them, okay, and it gives a lot of live feedback. That means it's really like whatever is happening in your body right now, you're getting that feedback, okay? And also your blood pressure machine. I mean, how accurate is your blood pressure machine? It really depends on, I guess, the type you have purchased, okay, and that you are currently using. So I think for those of you who may be wondering whether your equipment at home that you use is accurate, it will be good to check with your healthcare provider. Okay, maybe there could be some brands that your healthcare provider may recommend. So someone has actually shared that they use the SpO2 monitoring quite regularly, okay, and they found it really useful. That's great. I'm so happy to hear that it has benefited you and your family. Okay, so there is a question about someone's also asking like the use of telehealth between countries, whether there's any legal implications. Okay, so I think it depends on which, if your healthcare provider you have engaged, okay, it's someone overseas, right? For example, maybe you have to see this doctor that only practices overseas and you would really like to seek his or her treatment. Whether there are any medical legal issues, this has to be discussed prior beforehand, right? There will be likely some consent form that you need to sign or some informed consent, right? That you have to say like, oh, how much information you're willing to disclose this is between you and the clinic, okay? But I would say choose your healthcare provider carefully. In Singapore, every healthcare provider is bound by the PDPA rule, right? We cannot disclose information that can identify the patient. So it really depends on which country you have chosen to engage your healthcare provider as well. And I would recommend you look up what is the status of the medical legal system, okay, before you proceed. Okay, so very good questions. I think these are all very useful questions, okay? So maybe before I answer more questions again, let me just share as well, actually, how did healthcare started? Do any of you have any idea actually how healthcare started? How telehealth started, sorry. Okay, so actually, maybe you can have a think, may not have to really answer. Okay, but I will share with you actually why telehealth started. So it really started from bigger countries like Singapore, so small, right? And we are blessed with the convenience, you know, some of us where we stay, we have a GP clinic right below our block, okay, or maybe like our workplace, there's a GP clinic across. We are very blessed that we have this high concentration of clinics throughout our country, our city. All right. But in bigger countries such as the US, okay, and the United Kingdom, these are less common, especially in the rural areas, right? Your countryside. Okay. And it was found that research was found that people who tend to live in the rural areas, they actually are more at risk of dying prematurely. So meaning because they die slightly younger than expected, okay, because they do not have easy access to healthcare. They cannot go and, it's not like, ask where, okay, we're not feeling well, we want to go and see a doctor. It's just, maybe a 5-minute walk away or a 10-minute walk away, okay? So that's how telehealth actually started. They wanted to cater to these residents who are living in the countryside, okay, to make sure that firstly, they can get regular kind of like medical consultations, right? Okay, and in the event that they are experiencing maybe usually when it comes to like a major disease that someone experienced, there are usually warning signs leading up to it in the several days or several weeks leading up to, for example, if a patient starts to experience chest pain, okay, or discomfort around the chest or the heart area, right? This could be pointing to a bit of a cardiovascular disease, right? And the body is quite clever in the sense that there will always be early warning signs. And telehealth is this platform where once the individual is experiencing this, they can immediately get on this platform and then consult with a medical practitioner. Okay, so that drugs and drugs can be delivered on time. Okay, or maybe the medical provider can immediately advise them go and get emergency help. Okay, or they can deploy the emergency evacuation and get the patients to the hospital immediately. Okay, but if you notice, ever since this whole COVID pandemic started, right, we're trying to reduce the spread of infectious diseases. Okay, telehealth has now even come to our sunny little island of Singapore, where although we have very deep, very high concentration of clinics everywhere, okay, we noticed that it has proven itself beneficial in our country. Okay. Let me see what are some of the Q&As. So I think someone had a very good question. Do all hospitals and GPs in Singapore offer telehealth? So unfortunately, the answer is no. I think we're moving toward that to get almost majority of the clinics offering that. It will come eventually because I think there's a lot of benefits to it. Okay, so to answer your question, your current GP may not, but you can always call to check. Okay. Good. So some of you may be wondering, right? So in what instance is it good to use telehealth? Okay, so there are some instances, not every medical condition is suitable for telehealth. Okay, so let me share with you. So I'll give you a few examples, okay, when telehealth is good. So have any of you ever experienced maybe for the ladies, okay, but sometimes, ladies time of the month, very severe cramps, severe enough that we need to take MC from school or from work, okay? And you know how, as maybe gentlemen out there in this talk, maybe you have never experienced it, but maybe someone you love in your family, like your wife or your daughters have experienced it, or maybe even your girlfriends, right, have ever experienced cramps so severe that it's debilitating, cannot walk, okay? And they have to stay in bed, okay? So if the poor lady has to get MC for work or for school, what was it in the past? We have to walk down, go to the GP clinic, okay, take a queue number, sit there, wait, right, in pain, okay, and maybe even worse, no one to accompany, so have to do it alone, right? So in this instance, don't you wish that you yourself, or maybe the loved one you're witnessing who's experiencing this, could just stay home and then get the treatment done online and get the medications delivered, okay? Or just understand that this is in this situation, the doctor can see how much in pain the individual is and issue the MC without having to go downstairs and queue physically, right? What about this? Ever experience maybe a flu, okay, not feeling well, okay, where you just really want to stay in bed, you want to sleep, okay, to recover, okay, you know that if you go to the clinic, right, you are sneezing away. So this is maybe even before days of where we started all wearing masks, right? I think right now everyone's quite considerate. The moment you don't feel well, you just quickly put on a mask. Okay, this is something that we are now adopting in our local culture. Okay, but remember last time in the past where you're having a flu, you will go downstairs to the GP clinic, sneezing away, maybe the nose dripping, running, okay, and you have to sit there, okay, sometimes too cold in the GP clinic, you have to sit outside, right? Whatever the chairs or benches provided, and you wait for your turn, okay, and in this instance, also once again, you wish that you could just stay at home, okay, maybe not, don't want to spread the germs to someone, okay, or maybe even you don't want to catch germs elsewhere, right? Okay, and you want to just be able to get your consultation done and get your medications needed. Okay, so what about this other instance? Those of you who are on a repeated prescription, right? Okay, unless your condition changes, then you do need to see a doctor, consult a doctor, and then the doctor will then once again maybe adjust the prescription for you. But what if it's just to collect medications, right? Don't you sometimes your work schedule is very busy, and then by the time you need to go to the pharmacist, how many of you have ever experienced and work too late, got caught up at work, and then reach the pharmacist but the pharmacist is already off duty, or reach the clinic but the clinic is closed, so cannot collect the medication, right? Have to wait for the next day according to your schedule. Okay, so wouldn't you prefer if there could be a system where it is done online and immediately the drugs can be delivered to you? And I'm very proud to say that I think a lot of our local hospitals, our public healthcare hospitals, has already started to do this as well. Okay, where they deliver medications to you, or you can pick up a medication very near to you, like at a Guardian close to you where you stay. Okay, what if you are experiencing difficulty in moving about, meaning you have sprained your ankle, okay, or you have a bad knee, maybe your arthritic knee has flared up, it is very painful to walk, okay, or in some instances, maybe you experience a gout attack. And those of you who have gout or have seen your family or your friends or your loved ones get gout before, you will know that it's very painful to move about or to even put weight on the affected limb. Okay, so in this instance, you need the medication, okay, but you want to reduce the need to move, right? So then, don't you also wish that you could just see a doctor online, okay, and then get the needed prescription delivered to you once again? Okay, so these are just a few instances where maybe you yourself, you have experienced this before, you have thought about it, okay, that, oh, I wish I didn't have to really go down physically to the clinic, okay, and maybe you have yet to try now the new option of telehealth, okay, so this could be very suitable in your situation. Okay, I'm going to take some Q&A. Okay, I'm going to see some questions first, yeah? Yes, so someone has shared, like, it is very good for seniors. This is something we see so often because there's less, you have reduced the need to travel. Until all of us, right now, maybe many of us are quite healthy, we're quite agile, we can move with ease, okay? We do not feel the burden of it, right? But I think once you start to live with someone in your family, or you start to take care of someone who has difficulty moving, okay, you realize that telehealth is so convenient. it really, really saves them a lot of time, a lot of difficulties, especially maybe some elderly. Sometimes it's not even about the difficulty of moving, but no caregiver to accompany them to the clinic, right? Okay, because maybe they may not understand what is the medication needed, and it's always been the family member that has been discussing with the doctor and then explaining it to the individual themselves. Okay, so in this situation where it can be done online, I think it saves both the patient and also the caregiver the time and the it gives them convenience. Okay, very good. So yes, okay, eventually a lot of it, why telehealth started, right, was actually for medical. But then with COVID, okay, we then started to see it shift into physiotherapy. Okay, and I'll actually share with you a lot more later on shortly. But for many of us, we may not have known what telehealth is about. Okay, and these are some instances where we should use it. Okay, so stable and non-emergency conditions, right? So that makes sense, because if you're experiencing maybe a chest pain already, immediately, okay, and it's been recurrent, please straight away go to A&E. Okay, but for other more stable conditions like your headaches, your migraines that are repeated, okay, it is good to adopt this telehealth platform. Okay, even your chronic diseases, okay, that like what I mentioned, you just need a repeated prescription, go ahead and get onto this platform as well. So much is not known actually about physiotherapy or even the other allied health services such as occupational therapy. And this is actually very widely adopted in the UK. So I studied in the UK, and when we wanted to reach out to actually, so I did a placement in especially with the elderly, right, and those that live in the countryside. Okay, NHS has actually gone to help them set up telehealth within their home, okay, to set up the technical aspects of it so that they can have regular follow-ups with their practitioner. Okay, so in a lot of instances, sometimes it's not even just the elderly that will benefit from it. Someone who has just undergone a surgery, okay, and is awaiting, the doctor will prescribe, okay, you need physiotherapy right now, okay, to help you with your post-surgery rehab. And usually for those who have experienced ever done a surgery before from maybe a twisted ankle, or those who twisted their knee and tore their ACL, you will know that the first 2 weeks are usually the worst. Very excruciating pain, leg is so swollen, so heavy, very difficult to move about, right? And sometimes it's also difficult to go down to the clinic, the physio clinic. Okay, so this is where online sessions with the physiotherapist becomes very useful, very handy. The physiotherapist can actually, through the video call, assess your knee, look at how swollen it is, look at how you're managing your swelling, whether are you doing your techniques right, are you doing your gentle exercises correctly. Okay, so these are where instances, and I will share even more later on also. Okay, these are such instances where physiotherapy, telehealth then becomes extremely useful. And then once the condition is a lot stable, the patient is more confident of ambulating. Ambulating means walking, right? Ambulating in the community and, taking transport to go to the physio clinic. Then yes, that's where you're ready to have your sessions physical, face-to-face. Okay, but in the meantime, early stages, telehealth for physiotherapy is actually extremely useful. And I think it's there's a growing trend that people would be more open to consider that in their rehab journey. Okay, and even conducting so for those of us who need to do like a post-op x-ray afterwards, okay, you can go down to the x-ray center or a nearby x-ray clinic to do your physical x-ray scan. Okay, and then afterwards the results can be sent to your doctor, or your doctor will receive the results and once again share the results with you. So you notice that there's actually so much time saved, so much travel cost saved sometimes at the early stage where you are really in pain, and chances are you're not really going to want to take the train or the bus. You want to take a taxi or a Grab, right? Okay, and that's where, sometimes the option of having it online really becomes very useful. So in other instances, aside from the allied health services that I mentioned earlier, okay, there's a growing use for telehealth in counseling, okay, in mental health management. Okay, so a lot of psychologists and counselors are actually now seeing their sessions also conducted online through video calls, like okay, they're doing also embarking on telehealth, and it is so beneficial for the patient, because sometimes making your way down to the clinic can be I mean, let's just be honest, sometimes when you go to a clinic, and then especially what the clinic is known for, and then some people are a bit shy, they don't want people to see them. Okay, having it online also has that privacy to it, right? You can do it in the privacy of your home, okay, or your a quiet room in your office. Okay, and I think that's why it's actually growing trend amongst these healthcare professionals as well. So now, after sharing with you so much benefits, right, okay, of why telehealth, okay, I'll actually share with you how telehealth for physiotherapy was so useful during COVID, especially during the COVID-19 pandemic, okay, especially when we were all in circuit breaker. So it was passed by the MOH that physiotherapy was going to be considered as a non-essential service, okay, but yet so many patients needed physiotherapy in a very timely manner. So physiotherapy, I'm a musculoskeletal specialist, okay, so we may just envision that physiotherapy is just needed for, any pains or any injuries you have physically. But physiotherapy is actually not just needed for such conditions. Physiotherapy is needed in stroke patients. The earlier physiotherapy intervention is commenced in a stroke patient, the better the outcome for their rehab, or for them regaining back their function. Okay, so really time is of essence when it comes to such other conditions. Okay, or even if maybe some of you may not know, physiotherapy is also needed in cardiopulmonary conditions. So cardiopulmonary means your heart conditions, okay, or even your respiratory diseases. So yes, there are specializations of physiotherapy that target this. And it was during COVID-19 where these individuals who were suffering from such conditions could have access to it. So for example, where the patient is stable enough to be discharged home, right? But then they needed their continuous physiotherapy, the neurophysiotherapy, okay, that helps them to quickly rehab, to faster rehab for their stroke, right? A lot of patients found benefit in it, okay, because they could still do their rehab, okay, in a safe space in their home, okay, with their caregiver helping them out with it. And then even for pulmonary physiotherapy, okay, where patients who needed more guidance with, so for pulmonary rehab, right, actually there's a need to exercise so that the demand on the respiratory system will start to reduce. Okay, once you are stronger, you exercise, you get stronger, right? Actually your lungs, okay, don't have to work so hard. Okay, but once again, this needs to be addressed in the early stage of the conditions. And once again, a lot of patients benefited from physiotherapy during this period. Okay, and even patients who underwent a surgery, okay, and immediately it was everyone was a bit confused. How am I going to get treated? During this 2 months, 8 weeks wasted of, I can't do any rehab. Okay, and the doctors were very supportive in this. They actually said, do your physiotherapy online, engage with your practitioner so that he or she can guide you in the treatment as well. And it was really amazing. I think especially for Singaporeans who are so new to this, right? Everyone thought that physiotherapy needed to be physical, needed to be, there need to be some manual stuff that's applied to you. So manual stuff can be in the form of a deep tissue massage, like a scar tissue release. Yes, all these are good and beneficial, okay? But in such instances where you want to capture the treatment right in the early stages, right? Where you can't even apply so much manual work on the affected limb, this is where you want to at least tell the patient how they should manage their condition in the early stage. What you do at the early stage will affect your later stage of rehab as well. Okay, and we were very pleased as the whole physiotherapy industry that a lot of our patients started to give very good response. They responded very well and they gave very good feedback as to how physiotherapy had benefited them. Okay, so you would see maybe for some of you who had physiotherapy sessions, your sessions will go on like this. Your practitioner stands in front of a laptop, okay, shows you, guides you with the exercise, okay. Even so, with this photo on the right, you can see the patient, the practitioner is holding on to the parallel bars. Okay, so that is quite commonly seen in like neuro rehab or geriatric rehab, so rehab for the elderly. Okay, if this similar setup can be done at home where there's something stable for the patient to hold, okay, early rehab can be implemented so that the patient can quickly regain the function of their lower limb, okay, or even their core strength, even can regain some core strength so that it can sit upright in early stages of their condition. So these are really the benefits of physiotherapy in telehealth, okay, and we are trying to still educate the public, which is who is attending today, that there's so much more to physiotherapy than just having to come down for a physical session, or maybe even having the physiotherapy go do a home visit for you. In the early stages, do consider telehealth for physiotherapy. Okay. So there are so many benefits, okay, as I mentioned earlier on, okay, but one very lasting benefits of physiotherapy is that patients start to become very independent with managing their conditions. And you find that a lot of times the risk of re-injury is very low, okay, or the risk of a recurrence is very low. So recurrence of either, in many cases, is not so straightforward, right? With a stroke, right? There are so many other things to prevent a recurrence, such as medications, controlling your blood pressure, etc. Right? Okay, but they found that when patients are doing it on their own at home, it becomes a habit. So patients are more inclined to still continue doing it, and not just because, oh, today I'm going to the clinic, therefore I do my rehab. But then on days where I'm not in the clinic, I forget about my rehab. I don't do my exercises. Okay, it happens so often where I can see a patient in the clinic, we complete one whole session of exercises, and I see them 1 week later, I'll ask, so do you do your exercises at home? A lot of times they will smile, okay, they will laugh very sheepishly and say, no, I forgot, or no, I don't have time. Okay, so sometimes versus when it is done on a telehealth platform, right? Because they're already doing it within their home, okay? Maybe they've taken some time out of their work, like just even half an hour, 1 hour to do this consultation. It becomes a bit of a routine. They are more empowered to want to set aside time during their schedule to incorporate rehab in their daily lives. So as earlier mentioned also, another benefit is the accessible treatment, right? Once you start early, you have access to early treatment, you notice that your rehab tends to be a lot smoother. And in early days where you're suffering, in a lot of pain, or your condition's a bit more unstable, you can't really be traveling physically, okay? Or you can't really be traveling. Most of us, we may not have the luxury of owning a car, okay? And we may not have the luxury of being able to take a taxi wherever we go, right? Okay, so public transport like a bus or the train is our number one option. Okay, and you notice that this helps to reduce costs, because usually when you're not comfortable, you want to take a taxi or car, right? So if you can do it at home, why not? And you really can save you can save money, you can save time as well. And actually, so the countries that are a lot more ahead of us with physiotherapy, with telehealth, right? They actually did a research and they found that people who embark on telehealth for physiotherapy, they actually have a tendency not to cancel their sessions. So it's very funny. With physiotherapy, people are always requesting they want physical face-to-face treatments with their practitioner. But yet at the same time, there's also a lot of cancellations because people say, oh, so troublesome to go down to the clinic and have my rehab. So it becomes a bit of a dilemma. Do you want it to be done in the convenience of your home, or do you want to actually go down to the physical clinic? But at least there's a choice, right, for patients to choose if there's more options for telehealth physiotherapy, and they're likely not to cancel their sessions and to still come on the session online, have a video call. The practitioner can follow up with them, see how they're progressing, and also prescribe progressive exercise so that the treatment is always progressing. Okay, and you're getting better. Chances of regressing is much lower. So those of you, who have experienced this also before, feel free to share, okay? I think a lot of the audience would benefit from hearing it firsthand from someone who have experienced it themselves. All right. And finally, also one of the benefits for physiotherapy, okay, via telehealth is that you firstly offload the primary healthcare system. So what is primary healthcare system? It's basically your hospitals. Those are what we call the primary healthcare. And then once again, all your smaller clinics can be considered your secondary care system. Okay, so if you can reduce the need to always pop into your hospital for those who are doing their physiotherapy in a hospital setting, okay, it actually will increase your lead time. What's lead time? That means the ability to see your practitioner a lot sooner will be faster, will be more accessible. That means you don't have to wait maybe 1 month later and then you have your follow-up with your physio. Okay. You find that with telehealth, you can actually do like a weekly telehealth session with your physiotherapist. Okay. And you can eliminate the risk of cross-infection, especially when you go to hospitals, which is why a lot of the hospitals right now, they have actually also offered telehealth for physiotherapy, because a lot of times patients feel like if they go to the hospital, right, there's a lot more bacteria, there's a lot more viruses there, okay? And they don't want to expose themselves. So especially if the patient firstly is elderly, who are more at risk? Elderly, your pregnant individuals, okay? So for physiotherapy, there's something called pre and postnatal physiotherapy as well, okay? And you don't want your pregnant mothers or your pregnant wives, okay, or your wives who have just given birth, okay, you don't want them to catch an infection sometimes. Okay, so sometimes having it in the comfort, in the safety of your home is also a very safe option. And this is one of the big benefits of physiotherapy in a telehealth setting. Okay, and these are just some examples of patients who have actually really benefited from physiotherapy. A lot of them wrote feedback and said that it really did not occur to them how physiotherapy could even have been conducted online, but they were very impressed with the results. One of my patients, she had a very complicated knee surgery, okay, and unfortunately, she was at the peak of her rehab when the circuit breaker took place, okay, and in order not to let the condition regress, okay, we had all her sessions done online, and by the end of the 2 months, she shared that she was just amazed at how much improvement she could make on her own, on her own, with the guidance of a physiotherapist online. And she was a lot more quick to pick up. So of course, a lot of the sessions was a lot more independent, right? She had to do her own observation. She had to do her own feeling of the knee as well. But then she shared that it helped her to become more aware, to have more autonomy over her condition. And that was something that she really appreciated. Because as humans, sometimes we get a bit, lazy, right? Someone's always doing it for you, especially when it's done physically. But now suddenly when it's done online, you take charge of your own body and you do it yourself. So it's really good. We see that when patients are a lot more in control of their conditions, actually the recovery is a lot better as well. Okay, so before I move on to the next portion, okay, of our workshop, let me just try and catch some of the Q&As. So some of you are so good. You're asking questions that's actually leading up to my next topic, okay, to my next portion of the workshop. So let me try and answer your questions, okay, such as I think talking about the cost of it, okay, price point. And then someone asked, what is, okay, so actually a lot of you are asking a lot about pricing and cost. So I'll share with you actually what the benefits of telehealth in terms of costing. Okay, what other questions are there? So someone asked, oh, okay, so someone asked just now, so I think I flashed like physiotherapy versus occupational and occupational therapy, right? So I think some of you are wondering what's the difference. So if I can put it in a, if I can explain it in the easiest way, okay, physiotherapy, you can think of it as when you have pain, okay, we help to manage your pain. And I think earlier mentioned, we talked about neurophysiotherapy and cardiopulmonary. Cardio is for the heart and pulmonary, it means your respiratory system. Okay, so physiotherapy, we actually do it as a whole. We help you to get back to your, if as much as possible, before you fell sick, that level of your function, okay, that independence, we try to aim to get you back. Okay, but if we cannot get you back because maybe some of the side effects are permanent, okay, then we try to help you achieve slightly below, but what is the maximum potential of how much you can return to your pre-medical, to maybe your pre-surgery status. Okay, so occupation therapy is quite similar to physiotherapy, but they zoom in a lot more into your daily function. So for example, they break things down even as detailed as how do you dress yourself? How do you put on your clothing? They'll help you to achieve that. So we call it ADLs, activities of daily living. So the occupational therapists will start to look at how do you even do your toileting? How do you do things like making, cooking at home? Even simple things as how do you prepare a meal, to make a drink? Can you handle the environment of your home? Are you ready to return home? Okay, what is your ability? And they will start to help you achieve that, or if not, they'll help you to determine how much assistance you need. And then moving forward, the family can then determine how much assistance they can render to the patient, or whether they need to engage a full-time caregiver. Okay, so this is just a very broad explanation of the difference between physiotherapy and occupational therapy. Actually, they do have occupational therapy in itself also does have a lot of specialization, okay, which you can find out a lot more from the hospital websites when you go to try and look for occupational therapy. Okay, so I hope that answered your question. And then someone asked, how do you arrange or request for such therapy? I'm assuming you're talking about telehealth, right? Telehealth physiotherapy. Okay, so you have to probably speak to the practitioner. So let's say if you have already chosen which physiotherapist you want to or which practitioner you want to commence your treatment with, right? You probably have to ask them directly, because as of now, unless you are working in a hospital, you are seeking treatment in a hospital, I think generally whatever the hospital can provide, okay, it may apply to different faculties as well. But for private smaller clinics, you have to ask the individual clinics themselves. Yeah. Okay, so I hope that answers your question also. How do you arrange and request? Finally, someone also asked, do you use Zoom for telehealth? I can't speak for other clinics, okay, but personally, our clinic, we don't use Zoom. We use a clinical system that has where our video call is embedded, right? There's a safety feature to it. So it's like, it just ensures a bit more privacy. So every clinic does differently, okay? But generally, it depends on also what availability does the patient have on their smartphone or on their laptop. Okay, thank you so much for your questions. Okay, very good questions, very relevant. Okay, so moving on to the next portion of our workshop. Okay, so why do we use telehealth, right? Oh my goodness, so many benefits I already kind of mentioned earlier, but let me share a bit more. So I think a few of you did ask about the cost. Okay, so as earlier mentioned, I already said there was a lot of better access, right? You don't have to hobble down in your crutches or your swollen leg, or maybe how many of you ever had your leg casted in a cast? It's very heavy. It almost feels like it's a ball and chain, like you're chained to a metal, a weight. Okay, so it's very heavy. Okay, but having telehealth made available for you gives you better access to your practitioner. You don't have to queue, saves time. And once again, as earlier mentioned, there's a lesser risk of cross-infection, right? Okay. And this is something that I think we should try to consider, not just for ourselves, but for our loved ones, especially maybe for your loved ones who are not able to attend this talk today. Okay, you can actually share with them actually what are the benefits to telehealth and try to encourage them to embark on it. Okay, so then the next question, okay, someone asked about costing, right? So generally it depends on each clinic once again, right? Each clinic, they may set their telehealth sessions maybe at the same price or different price. Okay, that is up to you to go and clarify with them. Okay, but overall, right, it does reduce the cost on the person who's the consumer. Why do I say this? Okay, so those of you, even if your insurance, does your insurance cover the travel costs? Like you know, right, your insurance does not cover I mean, if you do know of any insurance that can cover your travel costs, please share. Okay, good things must share. Okay, but so far from my many years of practicing, right, I have not heard of an insurance that covers your travel costs. So let's say if you're not well, you want to go and take taxi every time. Remember, imagine you take a taxi down to the clinic, that is cost incurred. Okay, and you're the one that's bearing the cost. So even though your insurance can cover the full cost of your rehab sessions, don't forget you're also forking out some money for travel, right? Okay. Even so, another thing I want to share is also instances where sometimes it's cases like so it happened to one of my patients where she got into an accident. She got hit from behind. She was in a taxi and then she got hit behind. So ended up she was claiming against the driver's insurance, right? Okay. And yes, they do reimburse you for certain, like for your medical costs, and then but they don't, what is not sometimes not commonly mentioned is your time off from work. So maybe some of us are in jobs where however much you work, that's what you earn. Okay, that means we're not in a fixed salary job. Okay, so then it may not cover that loss of income. Okay, sometimes. So in a sense, so why do I say that? So that means so already firstly you're already loss of income, right? And then secondly, you still have to go down physically to the clinic. Isn't that even costing you a lot more? So sometimes we don't really think of this. Okay. And surprisingly, using telehealth does reduce the visits to A&E. So what do I mean? We have encountered previously when I used to work in a public hospital, right? We have encountered where when patients they got an injury, okay, but they don't know how severe it is, right? But most people, first thing will be, okay, let's go to hospital, and end up because hospital, the priority is to see life-threatening conditions. So it can even be maybe you have a torn ligament in your knee. It's excruciating pain, but you still have to queue your 6 to 8 hours before you see a specialist, right? Or to even see the A&E doctor. So I'll share with you what happened to one of my patients. He got injured during his work and something heavy fell on his toe. The flesh of his toe split open. Okay, his toe got a fracture, but he still ended up having to wait 10 hours at A&E because it was not a life-threatening condition. Okay. So of course, in his instance, yes, because the toe split, so he needed stitching, right? Okay, that's where he needs to go and see a doctor. But let's say if it's not a severe injury, okay, like for example, if it's a sprained ankle, but maybe you just want to rule out a fracture, this can easily be done in a GP clinic, who is able to also refer you to an X-ray clinic to then rule out any fracture. Okay, so reducing your visits to an A&E will help you save your time. okay, and it also overall reduce the load of the acute healthcare system. And especially in this time of COVID, right? Although we're already recovering very well from it, I think patients are also still not so keen to be waiting 6 to 8 hours in a hospital setting. Okay. Once again, we talk about the risk of cross-infection. Okay. So overall, this will really reduce your financial costs on your healthcare system. And this is a vicious cycle, right? Okay. So a lot of times when the healthcare costs increase, that's where our insurance premiums also increase. It's inevitable. But if we can kind of cap it low, okay, overall, generally, if it's kept lower, we might see a reduction, okay, or we might at least see a bit of a stabilization on the insurance premiums as well. Okay, so it's a very accumulative effect that maybe we don't really put much thought into it, okay, but it does affect how much you and I are all paying for our premiums as well. Okay. So next, telehealth is so good because it's so beneficial because it reduces the absenteeism from work. Okay, so what do I mean by that? Of course, if you're really not feeling well, please go take MC. Don't even continue working. But you know, in some instances, how many of y'all have actually been not well, but not well enough to really go on MC, okay, but not well enough to be performing at your peak? Okay, that means you still have work to clear. Sometimes we've all been there, done that, where we are rushing, you know, a deadline. Or maybe the team is very, you know, down with manpower. The team is very lean. Okay, you want to continue to work, right? Okay, so we don't want to just take MC like that. We want to complete our work, and you find that by the time you're done with work, clinics have all closed. Whereas versus if you could have just slotted in a 30-minute or even a 15-minute telehealth consultation during your the time of the day, during your lunchtime, or maybe like in between meetings, you saw the doctor via telehealth and then they got the meds delivered to your office, you can take it and you can continue working. Okay, so this is one of the benefits as well. Okay, and expounding on that, okay, it's convenient because you can fit it into your schedule. A lot of times clinics where actually when you do book a telehealth consultation in advance, you can even select your preferred time that you want. Okay, and finally, okay, it is beneficial for both young and old, as I have shared. Okay, so why young? Because the younger population makes up the majority of the workforce, means there's less disruption to our work. Okay, for the elderly, it's not as easy, okay, to move around. As someone has shared, it has benefited the elderly at home, okay, and you have saved time and convenience for travel. All right. So let me pose this question to you, or maybe you can even ask your families or loved ones, are you all actually all ready to embark on telehealth for not even just your GP or your consultations, even for your physio consultations, your rehab consultations? Will you consider this? Okay. So let me just quickly take some of the Q&A. Okay, so I will finish up soon. Okay, but maybe I will just try my best to answer one last Q&A. What is the limitation of telehealth app, especially for developing countries? Are you talking about the limitation? I would say maybe if the patients do not have access to your communications technologies, like not every country. I mean, right now in Singapore, almost everyone has a smartphone, okay, but we'll be surprised that there are some countries where we don't have access to all these technologies at hand. Okay, so I think that's one of the downside of one of the limitation. Okay, but other than that, I think it actually is in developing countries, actually there would be um, even if it's not every household may not have one, but I think there should be a bit of access to some of these kind of video platforms where they can host this telehealth consultations. Yep. Okay, so thank you once again. Okay, so let me just share. Okay. So maybe you can give us a bit of your feedback, okay? by scanning this QR code. In the meantime, as you scan this, let me just try and see. I think a few other people are asking more questions. Very good. So I'll answer that in the meantime as well. Oh, okay, interesting question. Someone's asking if you do the telehealth consultation overseas and you need medication, does the clinic, I would say, I'm assuming you're mentioning about the clinic, whether will they send the medication overseas? I think in this day and age, a lot of medications can also be like, you can find similar medications. If it's not the same brand, it'll be the generic kind of medications where you can find it also available in overseas pharmacies. And I think that should not be a problem. But in the instance where a medication is really only available, in a particular country, and once again, I'm very sure if you liaise with the practitioner or the clinic themselves, right, they can arrange for the medication to be delivered. Yes, especially if it's a condition where it is quite serious, okay, and it only can respond to this particular medication, I'm very sure it can be arranged for. Yes, or I mean, that is the purpose of telehealth, right? But once again, if that's not possible, I mean, that's one of the reasons why you see in Singapore, we have something called medical tourism, where people actually fly in to come and seek treatment with our local practitioners. Okay, so I think that can also be arranged for. So if you do telehealth, very good question. If you do telehealth for overseas clients, how do they pay for treatment? Online payment. Yeah, so you can do a bank. I mean, I'm sure that once again, depending on clinics, right? You can do a credit card payment, you can do a bank transfer, you can do so many PayPal. Yeah, a lot of options these days, which is why we can do our online shopping, right? We can buy something from another country and you can still get it. So as long as you use that particular platform, I'm sure payment can still be made. So thank you so much for your kind attention and your participation. I hope you have learned something about it today. You can share it with someone who will benefit from it. Okay.